Good morning, this is Paul Palmer. Today I'm going to talk to you about being a QP, why I became one, which if you've seen the previous videos you'll know already. But anyway, and actually being a QP, what it means. Because I often get asked by people, how do I become a QP? What do I need to do? How do I get there? And the first thing I ask is why? Why do you want to be a QP? Well, in the UK, the common response is money, because the QP is paid well, especially when you go contract. But that can be a good thing, it can be a bad thing, because some people that aren't QPs then envy the salary that you get paid, or the fee for your services. Anyway, back to the point. So I became a QP because I wanted a career that would always be in demand. I chose it, and within 6 years, I achieved my goal. Okay, so I know people that go a lot quicker than that, but I completed my course and I passed the Viva. So I completed in July, I think it was, and I passed it in October, which at the time back in 2004 was quick. Now, what does it mean to be a QP? Well, the role of the QP is about patient safety. And the biggest thing that you need to consider is, are you aware of what's happening with the product? So in these times where we have the coronavirus, we have the lockdown, there's a huge demand, but people are restricted on what they can do. So how can they actually complete all the activities that they need to ensure that the product we're supplying, the medicines, are safe? So you'd have to only participate in essential activities. You only have to do essential travel in the UK. In India, it's been a lockdown more than that, but they have special permission for processing pharmaceuticals. But what they fail to consider when they provide special provision is transport. So if the materials are coming from China, for example, the API, shipping across, well, the shipping agents don't have special permission, so where do they go? Then they get to the country, and the train doesn't have special permission, so how does it get there? Well, lorry more than likely. I don't know the details because I haven't checked. The shipping agents, how do they get things from the docks to us? There's restricted carriers service on the aircraft, and the boats in general take too long because we're going to be out of stock. So where do you go? But this is a concern for the QP, because the QP's looking at patient safety. Now, continuity of supply is just as much of an issue for patient safety as failures to meet the spec. Now, we need to get the product here. Okay, so you ship via the countries that are still operating. Well, that tends to be at the moment the Middle East. So Dubai, Qatar, and then the plane has to unload and load onto the next plane. So what happens there? Well, it's 40 degrees C, maybe a bit more. And your product, well, is that going to be compromised? Now, most products have their temperature ranges specified. So if it's a less than 25 and it is exposed to 40 degrees for 2 hours, what's the risk? Then, of course, you might consider putting it into something that cools it constantly. But what happens if that goes too low? Maybe you hit -2. Is the product at risk? Who's going to make the decision? Do we need to do a batch-specific variation? Do we need to review the stability data? Do we have the stability data? Do we need to put the batch back on stability testing to verify that actually this batch is acceptable? All these considerations need to come to the QP before he can release the product. So if you are considering becoming a QP, if it's something that you want to do just because of the money, then it's not the reason to do it. You're a part of the supply chain. You're ensuring that the actual medicine that's been manufactured, whether it's on the site where you're working or remotely, whether the API is manufactured in the same country or a different country. You need to assure yourself of the quality of the product before it's placed on the market. You need to assure yourself that the shipping has been carried out in accordance with the correct conditions. You need to assure yourself that when it's been handled on receipt, just because the people in the warehouse were not there to unpack it, and you can see that there was a temperature excursion, you need to know that the product wasn't subject to that same temperature excursion. You need confirmation in writing that it was actually processed properly. So there is more to being a QP than just taking the money. Okay, that's it for now. Talk to you soon.